Paramedics should check all procedural sites frequently, watching for subtle changes that may indicate internal bleeding. Swelling can begin as a faint puffiness around an IV site, sometimes progressing rapidly. The skin may feel firmer or cooler as blood pools beneath the surface, or the color may shift subtly. Dark or purplish hues can be easy to miss in poor lighting or under clothing. Diligent observation, even when initial results seem satisfactory, is crucial. Patients may not always articulate their symptoms clearly. For example, a child may become irritable or refuse to use a limb rather than complain of pain. Elderly patients might be less expressive or attribute discomfort to other causes. For airway management, have the alert patient attempt speaking or swallowing. Difficulty or a change in voice should prompt immediate reassessment. Gurgling, stridor, or raspy breathing are late signs of possible airway compromise and likely indicate bleeding or a growing hematoma. Subtle cues paired with attentive questioning allow paramedics to catch worsening symptoms early. Another important aspect is monitoring vital signs. Tachycardia can be a sign of blood loss even when bleeding is not externally visible. A falling blood pressure, increasing respiratory rate, or changes in capillary refill time should raise alarm bells. Document each set of vitals and check frequently, especially during transport. As shock develops, patients with bleeding disorders may decompensate more rapidly due to impaired clotting mechanisms. Early detection can make all the difference. When an expanding hematoma is detected, paramedics must act swiftly. Elevate the limb above the level of the heart whenever possible. Gravity slows blood flow and can help reduce hematoma growth. Never use excessive force or constrictive bands, as these can cause additional tissue injury or compromise underlying circulation. Monitor for changes in distal pulses, skin temperature, and motor function. Signs of compartment syndrome must be taken seriously, as this condition can lead to limb-threatening complications. For airway hematomas or active bleeding in the mouth or throat, keep suction ready, but use as little as necessary to avoid aggravating fragile mucosal tissue. Position the patient with the head slightly elevated and keep rescue airway tools within reach. If breathing worsens, activate advanced airway protocols and urgent transport without unnecessary delay.